Hello?
Over the next 25 years, more than 100 million people around the world are at risk of going blind. As many as 300 million could be visually impaired. It's happening in Africa, in Asia, and in Latin America. Without dramatic action being taken now, the number of blind and visually impaired people in Latin America will more than double in the next 25 years. The consequences that this will have on the lives of the individuals affected will be devastating. Children will have trouble learning. Many adults will be unable to care for themselves or to provide for their families. In many developing countries, work is underway to stop this from happening, or at least to slow it down. It's the work of VISION 2020, an international program aimed at eliminating the main causes of preventable and treatable blindness. Partnerships are being formed throughout Latin America. The campaign is already having a dramatic impact on the lives of our friends and neighbors. In Paraguay, a farmer once blind can tend to his cattle once again. A young doctor from Ecuador learns new skills to save the sight of people in his country. Premature babies at high risk of blindness will now get help in parts of Brazil. People with extreme low vision will be able to care for themselves. These stories are emerging throughout Latin America. They are stories of hope and promise. Dr. Reinhold Dirksen is the chairman for Latin America of the International Agency for the Prevention of Blindness. The IAPB and the World Health Organization are working on the VISION 2020 campaign together. The goal is to ensure the right of all Latin Americans to be able to see their countries through their own eyes. Dr. Dirksen lives in a remote community in central Paraguay, but he is traveling across Latin America, bringing together teams of ophthalmologists, foundations, governments, and non-government organizations.
Most of us are quite privileged because we take sight for granted. We're able to see things around and do simple tasks, go to work, eat, everything we do. A person who does not see, they want to see the food they have in front of them. They want to see their grandchildren. They lose jobs because they cannot work. They lose dignity. And 80% of all the blind people do not need to be in that situation. Pedro.
Cataracts in both eyes cost Pedro Lodos his vision 5 years ago. He could not see to manage his farm, to feed his family. The future looked bleak. But because of the VISION 2020 campaign, he can see again. His cattle herd has grown from 2 to 16 animals, and a smile has returned to his face. In Asuncion, Paraguay, there are doctors from all over Latin America training with a not-for-profit organization called Fundación VISIÓN. This ophthalmologist is from Bolivia. She's here learning to be better at dealing with eyesight problems, especially among the poor.
La solución, como en todas las alergias, es evitar esa sustancia.
In Rio de Janeiro, Dr. Andrea Zinn sees dozens of premature babies every day.
So the disease regressed completely, and I'll discharge this baby.
Retinopathy of prematurity is a growing problem in Latin America. Improvements in healthcare now allow for more premature babies to survive, but 10% of them are at risk of growing up blind.
The problem is becoming an increasing blinding disease here is because the babies here are surviving. We have increasing level of development in our neonatal units. The babies are surviving, so mortality rate is decreasing. And we have a population at risk to take care of.
Now, in half of Rio, Dr. Zinn is screening all premature babies for ROP. As a Vision 2020 Latin America Childhood Blindness Chairperson, she wants to expand the program to all of Latin America.
We are expanding the program, so now we have programs in Recife and Fortaleza, Belém, and we are planning more programs for the future years.
In rural areas, visually impaired people often have to travel hundreds of kilometers to have their sight improved or restored, if eye care is available at all. This woman was brought here by her daughter-in-law. She is blind in one eye, almost blind in the other. Dr. Miguel Scalamonia will remove the cataracts from one eye while ophthalmologists from Bolivia and Argentina watch and learn. This patient's surgery goes well. She joins more than 20 other patients in the recovery room. Tomorrow, her bandages will be removed. She's excited about what that will allow her to see.
Así decía antes de operar, creo que va a salir bien, ojalá que salga bien y para ver mucho tiempo todavía mi nietito chiquitito, dice.
Vision 2020 is also helping Latin Americans living with extremely low vision and those that will never see again.
Tem bastante porque se não fosse o tratamento que eu tive aqui desde criança.
If he wouldn't have a chance to come to Santa Casa, he wouldn't have the possibilities to face the world outside.
Fernando found help almost by accident at the La Santa Casa Hospital. His parents believed he was blind and mentally challenged. In reality, he wasn't. Dr. Sylvia Weitzman diagnosed him as having low vision, offered him training, and it has changed his life.
By 7, he couldn't read yet, and he had a lot of difficulties in school, and of course this was due to vision mainly, but as no one was capable of diagnosing his poor vision and working with him, he was considered a mentally retarded child.
The clinic helps children with low vision to discover new ways to read and play.
O meu nome é Cebolinha. Quero ser seu amiguinho.
We had started with a little seed. Will fructify, will multiply, and will be all this investment flourishing. I'm sure that people will be suffering less on the problems of blindness.
For this woman, the most important part of her day was reading her Bible. For 6 years, she couldn't read at all because her eyesight had faded badly. She has been fitted with special glasses and is being taught how to use them.
To have a lady like her and seeing that she got a benefit on just wearing a pair of glasses and being trained a few days to know better how to read from now on with her eye condition is really very good, make you feel good, not just the group of people here, but the family understands that something had changed.
A única coisa que eu mais amo, que eu mais gosto, é isso aqui, a Bíblia.
Dr. Van Lansing works with Fundación Vision and is the program coordinator for Vision 2020 throughout all of Latin America. His goal is to improve the coordination of services among doctors, governments, and funders in each and every country. The list of partners is growing as more people understand how critical this is to the future of this region.
You cannot turn your back on the problem. The problem is there, and we have to do something about it. It has to be done now, because those children especially that are blind right now, and we can recover them, or those that, especially with other diseases like diabetic retinopathy or glaucoma, if we don't do anything about it right now, it doesn't do us any good, because they're going to be blind for the next 15 or 20 years, all their productive life, and what that means for not only for them, their families, and the society.
In developing countries where most of the world's blind live, the resources available to tackle the problem are usually insufficient. There is a lack of trained eye personnel, medicines, ophthalmic equipment, eye care facilities, and patient referral systems. Many hundreds of thousands of people will go blind before help arrives. In financial terms, the cost of caring for the blind and the loss of their potential productivity has been calculated in the billions of dollars. However, there is no price that can be put on dignity, happiness, and independence.
I see a good perspective in the work on Vision 2020, trying to make low vision more accessible and more understandable, either for the professionals and for the patients that need this kind of management.
I have to do something, and I have to reach them, so I have to come in a place like this and to do the work. And you know, even with my work, I'm not doing everything that is needed to do.
Helping people to see, to take care of themselves and their families, that is the vision of the International Agency for the Prevention of Blindness. It's a vision that will dramatically change Latin America by the year 2020.